Can you hear me? Can you hear me? Can you hear me? Can you hear me?
Yes. هو
Okay.
قطع وانا بقول I don't know.
Okay. Yes. No, I heard you. I heard you saying, I don't know. Somebody's writing in the chat. Type. Never mind. Okay. Type. Can you see my slides now? Can you see my slides?
Yes,
Doctor.
وعلى
Yes,
طول
Doctor.
so
Are they full screen or small?
full screen.
Great. So this lady, I was telling you that in primary hypothyroidism, there is this peaches and cream complexion in Caucasian persons who, when they are normal, they have a fair colored skin that is pink in color. But when they develop hypothyroidism, the skin turns orange yellow in color, the color of peaches. Why is that? Because in hypothyroidism, the basal metabolic rate is suppressed. So all possible enzymatic reactions in the body are suppressed, including conversion of beta carotene that we consume in the diet in carrots, tomatoes, bell pepper, mangoes, cantaloupe, etc. This beta carotene is not converted into vitamin A. Okay, so the result will be hypercarotenemia, the increased level of carotene in blood, and this will lead to deposition of carotene in different tissues, including the skin of the face and of the palms and soles as well. Okay? So this peaches and cream complexion is seen in Caucasians who have hypothyroidism due to hypercarotenemia, but in our part of the world, because the skin color is mostly either amhi or bronze in color, and the Nubians are also black in color, so we don't appreciate this peaches and cream complexion very much, but we can appreciate the pallor. All right. In addition to the peaches and cream complexion, the patient's face appears swollen. Okay, she has periorbital puffiness. Okay, she has a swollen nose, swollen lips, and an enlarged tongue. Here we don't say enlarged tongue and enlarged lips because it's not the case like in acromegaly. This is not due to active growth of the tissues, but it's rather due to swelling under the effect of hypothyroidism. But here the eyebrows are intact. Okay, the scalp hair appears dry and brittle and poorly managed, as if the patient has woken up from sleep and she came to see you like that without combing her hair. Okay, this is another a lady, you see, another Caucasian lady with very, very evident peaches and cream complexion. You see, the butterfly area of the face appears as if خوخة كل خد عليه خوخة. You see, and the nose as well. And she has a swollen face as well. Okay, she has periorbital puffiness and she has this apathetic look. She looks apathetic as if she's still sleepy. You see, عينيها مكسورة كده. And she has loss of the outer thirds of the eyebrows, right? And she has swollen nose, swollen lips, and the scalp hair appears dry and brittle and poorly managed as well. All right, is it clear? Now let's continue the signs in hypothyroidism. There is hypertension. Here the hypertension is diastolic, right? I will compare that later on with the hypertension in hyperthyroidism. Why? Because here it's multifactorial, but mainly because there is dyslipidemia leading to premature atherosclerosis and stiffening of the arterioles, leading to increased peripheral vascular resistance. There is hypothermia. Hagga Zainab, when I measured her temperature, she felt very cold. Okay, I mean the skin felt very cold all over, but when I measured her temperature, the thermometer wouldn't read. It was 35. Okay. Heart failure may occur in hypothyroidism. Bradycardia. Hagga Zainab had a heart rate of 45 beats per minute. Pericardial effusion. Actually, in Hagga Zainab, she had pericardial effusion, bilateral pleural effusion, and ascites. And as I mentioned, she was admitted to the ER as ascites for investigation. All right. Myotonia, but this is not very common. Muscular hypertrophy, also not very common, but again, proximal myopathy. Okay. Proximal weakness, weakness of the shoulder and pelvic girdle muscles, right? And there is also slow relaxing reflexes. I will show you a video how to elicit those. The typical sign would be a delayed ankle jerk relaxation time of the tendo Achilles. And cold peripheries, actually, Hagga Zainab, not only did she have cold hands and feet, but she was cold all over the body. Carpal tunnel syndrome, okay, like I will show you in the videos by eliciting Tinel's and Phelan signs, okay. You will also find edema and pallor. Pallor, why? Because those patients, they usually have anemia. And what kind of anemia can be seen in hypothyroidism? Who can tell me? What kind of anemia?
Microcytic?
Hypochromic microcytic if the patient is a female with menorrhagia, excessive bleeding with the blood loss. It can be also what? What type of anemia?
Macrocytic?
Macrocytic, very good, or megaloblastic if the patient has what?
Intrinsic factor antibodies, something like this.
Yes, if the patient has pernicious anemia, if the patient has autoimmune thyroiditis as the cause for hypothyroidism, it may be associated with other autoimmune diseases as well, including pernicious anemia, which is due to formation of parietal cell antibodies that attack the parietal cells, destroying the secretion of intrinsic factor, which is important for vitamin B12 absorption from the ileum. Okay. Or the anemia may be that normochromic normocytic anemia of chronic illness. So you can find any of these types of anemia in a hypothyroid patient. All right. The classic picture of the slow, dry-haired, thick-skinned, deep-voiced patient with weight gain, cold intolerance, bradycardia, and constipation makes the diagnosis very easy, but actually milder symptoms are more common and they are hard to distinguish from other causes of nonspecific tiredness, and many cases are detected on biochemical screening. And some special difficulties in diagnosis may arise in certain circumstances, like, for instance, children with hypothyroidism. They may not show the classic features that I have mentioned earlier, but often they have a slow growth velocity or short stature. So in any short child, before working him or her up for growth hormone deficiency, you need to check first TSH and the thyroid functions, right? Or poor school performance, because the patient has poor memory. He cannot memorize. He cannot stay attentive when the teacher explains in class. Or if the child presents around puberty, he or she will show arrest of pubertal development. Okay? Also, young women with hypothyroidism may not show obvious signs, but hypothyroidism should be excluded in all female patients presenting with oligomenorrhea or amenorrhea, menorrhagia, infertility, or hyperprolactinemia. Okay? Also, the elderly show many clinical features that are difficult to differentiate from normal aging. All right? This is why in elderly, whenever you suspect that this elderly patient has hypothyroidism, do thyroid function tests. Now, let me show you some pictures of hypothyroid patients. When I tell you hypothyroid faces, written with the CIES at the end, what does it mean? In other words, what is the difference between faces and face, CE? Is there a difference? Or are they both terms synonymous? Who can tell me? Huh? Who can tell me? Are you still there?
Yes, no idea.
No idea. Okay, I will tell you. That when can you still see my slides?
No.
Okay.
Not
Why, doctor?
I will share again. All right. All right. Do you see my slides now?
yes, in slideshow.
All right, great. Whenever I tell you hypothyroid facies, the term facies means facial features of. So acromegalic facies, facial features of acromegaly. Cushingoid facies, facial features of Cushing syndrome. Okay, thalassemic facies, facial features of thalassemia, and so on. Okay, but when I tell you examine the face of the patient, this entails all the details that the face holds, starting from the skull size, like we have seen in acromegaly, the bony prominences of the supraorbital ridges, the maxillary bone, the jaw, the size of the nose and the lips, the eyebrows, whether they are intact or whether they are lost or they have loss of outer thirds, whether there is periorbital puffiness or swelling, whether the whole face, whether it is swollen, the color of the skin of the face, whether there is any butterfly rash, whether there is any peaches and cream complexion, whether there is any cloasma, okay, the size of the nose and lips, and not only that, but also the eye itself, the eye, including the eyebrows, the eyelashes, the eyelids, the cornea, whether it is clear and transparent, or whether there is a corneal ulcer or any corneal opacity, okay, the conjunctiva, whether it is normal or whether it is injected or whether it is chemotic, like we are going to see in the eye signs of Graves' disease, and the nostrils, whether they are normal or whether there is bleeding from the nose, whether there is discharge coming out from the nose, the mouth cavity, the oral cavity, the gums, whether they are hypertrophied, whether there is bleeding from the gums, the teeth, whether they are normal, whether there is prognathism, like in acromegaly, whether there is interdental separation, the size of the tongue, and the tongue itself, whether it is coated or glazed, or whether there is pigmentation on the sides of the tongue, like in Addison's disease, like I'm going to show you in the second revision session, inshallah. And the teeth, whether there is loss of teeth, whether the patient is wearing dental prosthesis, whether there is poor dental hygiene with pyorrhea alveolaris or pus oozing from the gums, like in many diabetic patients, whether there are caries teeth and so on, whether it is candidal eruption, whether there are petechiae on the hard palate or on the buccal mucosa, whether there is hyperpigmentation on the inner aspect of the buccal mucosa. All that you need to examine when you are asked to examine the face of the patient. Okay, is it clear? Now, these are three ladies. Two of them are of the Caucasian race. One of them is of the black race. Okay, one is elderly, one is middle-aged, and one is young. But the three of them share a common facial features, namely those of hypothyroidism. So who can comment on the picture on the extreme left? This one. Yalla.
Yeah, periorbital puffiness.
Yes, very extreme, even here on the right side. Huh? She has, as if she has a bag of water affecting the lower eyelid. Yes, what else?
Pallor.
Yes, extreme pallor. Although she is Caucasian, but she doesn't have peaches and cream complexion. Very good. What else?
Apathic?
Yes, apathetic look, as if she's sleepy. The eyes are not lively, kid. Here the eyebrows are intact. There is no loss of the outer thirds of the eyebrows. What about the scalp here? Does it appear normal?
Hair loss. There is loss of hair.
Yes. In
on the
particular
left
here
side.
on the temporal region. Temporal recession in males is something very normal, but in ladies, this is something abnormal. All right. Here, of course, we cannot see the other side, but here she has marked temporal recession of the left side. So this means that there is loss of scalp hair here in this area. Okay? Now, what about the size of the nose and lips? Are they normal or are they swollen? Huh?
The nose appears a bit swollen, but I
Yes.
think the lips looks
Looks
normal.
Okay,
normal.
of course, we wouldn't be able to know 100% just by looking at one picture of the patient. It would be better to see the picture of the patient when she was normal, how she looked like, and then after she got sick, like I will show you later on. Okay, very good. Thank you very much. Another student, please, can you comment on the picture of the lady in the middle? Somebody else. Unfortunately, I cannot see the participants list now because if I look at it, the share will disappear again. Okay, so somebody volunteer, please. Don't take much time because this is out of your time and we will lose a lot of time of the precious 40 minutes. Okay?
She is pale,
Yes, extremely pale. Very good. What else?
hair loss,
Yes, bilateral temporal recession of the scalp hair. And the scalp hair appears also dry, rough, and brittle and poorly managed. Okay, what else?
eye puffness,
Yes, periorbital puffiness bilaterally. Very good. What about the eyebrows? Something wrong with the
loss
eyebrows?
of outer third. Yeah.
Yes, more evident here on the left side, maybe. Loss of outer thirds of the eyebrows. Very good. What about the size of the nose and lips? Are they swollen?
Yes.
Yes, a bit. Okay, thank you. Right. Somebody else, please comment on this lady on the right. Yalla, who will tell me? Come on, we're losing precious time. Do you want me to skip? Huh? You want me to skip the hypothyroid faces? Can you still hear me?
Oh, doctor. Yeah.
Yalla, tell me, doctora. Tell me, please.
There's a pathetic look.
Yes, very good. What else?
Periorbital edema.
Yes, mild, not as much as
Yeah,
those two, yeah?
not as,
Yes,
yeah.
yes, okay, what else?
I cannot comment on the nose, it's not clear, but the lips is a bit swollen.
But
I
take
think
care, take care.
it's generally,
This lady is from the black race.
yeah,
So here it's sometimes normal,
normal.
quite normal for people from the black race to have large noses and lips like that. So what you do is that you ask the patient, did you notice any change in your nose and lips or in your face in general? If she tells you no, so this is how she looked like ever since, before getting sick. But if she tells you yes, you ask her, how did it change? She will tell you, my nose and lips are swollen. Okay, my eyes are puffy,
Okay.
and so on. Okay, very important. Very good. What else?
Also, the hair, I cannot comment on the hair because I think
Yes, it may be racial.
it's very
yes.
racial, yeah.
Yes, the black race usually they have all coarse, thick
But
hair.
she's pale.
Yes,
She
you
has
can
a
tell. You
pallor.
can tell that she is pale. Very good, excellent, very good. Now we have two other patients, a young lady and an elderly gentleman. Both of them they have hypothyroid faces. Okay. In addition, I want you to notice the neck of this young lady. Okay. Right. Who would like to comment on the lady? Yalla, it's easy. Huh? Who would like to comment? Come on.
الهير
Yes. What about the hair?
هو كأنه مقصف.
أيوة.
Fine.
Brittle, dry, and poorly managed. Yes. What else?
eyebrows normal.
Yes. Here you say no
they're a
loss
bit
of.
puffy.
Here, don't say normal. You say no loss of outer thirds of the eyebrows. To tell the examiner that you have looked for this sign, but you didn't find. It's a good negative sign. Okay? Yeah. What else?
Okay. النose والlips are a bit swollen.
Yes.
وفي peach and cream complexion.
Yes, here it's very evident. Okay. So what about the neck? She looks a bit apathetic as well, right? She's a bit apathetic. So what about the neck? What is this?
حسب
I'm not talking
Webbed
about a
neck.
goiter. She doesn't have a goiter. I'm talking about this.
Webbed neck.
Yes, web neck.
Web neck.
What does a web neck
Turner?
signify? Sorry?
Turner syndrome?
Turner syndrome. Excellent. طب what is the association between Turner syndrome and hypothyroidism? Or in other words, is there any association between Turner syndrome and hypothyroidism? Huh?
الديسهرمونوجينيسيس ولا بتبقى حاجة
Amenorrhea.
No. Turner syndrome. No. Turner's amenorrhea is part of Turner syndrome because the patient has streak ovaries and a rudimentary uterus. Okay, but it's not that. Studies have shown that patients with Turner syndrome have a higher incidence of developing hypothyroidism than patients not affected with Turner syndrome. Okay, so this is the link. It's more, Turner syndrome patients are more common, more at risk to develop hypothyroidism than their peers who don't have Turner syndrome. Okay? Right, very good. Now, who would like to comment on the gentleman on the right side? Very easy. Yalla, come. Come on, very easy.
برضه الhair is sparse and brittle.
The hair is sparse and brittle, but take care. This gentleman is old. So, and he is a man, okay? Men tend to turn bald, okay? So, yes, I agree that the hair is brittle and poorly managed. كأنه منكوش يعني, huh? But you ask the patient, if you have the patient in front of you, ask him, did your scalp hair change in any way? If he tells you no, خلاص, this is his usual. If he tells you yes, then you ask him, how did it change? He will tell you, it has fallen off. I became bald. I wasn't bald before. So then you need to comment. Okay? All right? Type, what else? What else?
Loss of the outer 1/3 of the eyebrows.
Yes, it's very evident, particularly on the left hand side. Very good. What else?
Peachy cream complexion.
Yes, mild. It's milder than this lady, but it's there, particularly on the left cheek. What about the eyes? Is there any puffiness?
Yes, there is mild puffiness here.
Yes. Is there any apathetic look?
Yeah, there is.
Okay. What about the size of the nose and lips? Can you comment on those?
No, I think it's normal. It looks normal anyway.
Okay.
So I have to compare it or ask the patient.
Yes, very good. Very good. Excellent. Type. Now we have a young gentleman and a middle-aged lady. Both of them have hypothyroid faces, right? Who would like to comment on the gentleman's face? Huh?
Loss of hair? I can comment,
Yes. Here, he is a man, okay? So it's perfectly normal for a man to have temporal recession. But notice he has more, temporal recession is more on the left side than on the right side. This means that كأنه منحول يعني أكتر, all right? Okay? Very good. What else? What about the rest of the scalp hair? What can you comment on? What can you say about the scalp hair?
Brittle hair.
Brittle, yes, it's dry, rough, and brittle, and poorly managed as well. Very good. Type. What about the eyebrows?
Loss of outer third.
Very evident. Again on the left side. Okay, very good. What else?
Peritemporal edema.
Periorbital.
Periorbital, sorry.
Edema. Yes, periorbital edema. Yes. What else?
Peach and cream complex.
Yes, here it's very evident. You see the rest of the skin color is yellow, pale in color, but the cheeks and the nose are orange yellow in color. Very, very evident. Very good. Does he have an apathetic look, this man?
Yes.
Yes, very good. What about the nose and lips?
Enlargement في edema في النose
Yes, particularly the lips, as if they are blown up يعني, huh?
Yes.
They are very swollen, you see? And not only the nose and lips, the whole face appears to be swollen, and the neck as well, right? Very good. Thank you very much. Type, yalla, who would like to comment on this lady?
I can comment.
Okay, go on.
She looks like she's having a pathetic look.
Yes.
Periorbital edema.
Very good, particularly on the left side. Yes.
Yeah, she's pale also.
Yes.
And she's having swollen nose.
Yes,
But
very
the lips,
evident.
I can't say the lips are swollen.
The lower lip appears
A
to be
little
swollen.
bit.
Yes, yes, yes. But the face appears to be swollen as well. The
Yeah, the
cheeks
face
and
itself appears to be swollen.
yes,
Yeah.
yes. Okay. What about the eyebrows? Are they normal?
And the outer 1/3 يعني هي صورة مش واضحة بس one side is normal, the other side I can't comment on it اللي هي فيها puffiness دي اللي حضرتك.
Actually, both eyebrows appear to be thinned out. The hair of both eyebrows appears to be thinned out. But some persons are normally like that. So if you have the patient in front of you, you just ask her, did you notice any change in your eyebrows? No leading questions. If she tells you no, alas, this is her normal. If she tells you yes, then you ask her, how did they change? She will tell you the hair became thinner. Okay? Or they became less sparse.
Yeah.
So what about the scalp hair? Is there something wrong with it?
It is brittle, thin and brittle.
Yes, it's poorly managed as well. يعني كأنها منكوشة يعني ها. But it's not dry. Okay. طيب, what about the neck? Can you comment if there is any goiter?
You can comment she's wearing something on her neck.
Exactly. So in the exam or whenever you face any patient that you want to examine the neck for either for the trachea, for lymph nodes, for the neck veins, for the thyroid, for venous congestion, and the patient is wearing a veil, a collar, a high neck collar blouse, you ask the patient kindly to uncover the neck because you want to examine this and that. Okay, so here all you can say is I cannot examine the neck because she's wearing a collar, like you said. Okay, thank you very much. Now you see this picture. Remember Hagga Zainab that I used to tell you about? She looked exactly like that, but she wasn't very pale like this patient because she had a tan color. Her color was tan. Okay, so this peaches and cream complexion as well was not evident in Hagga Zainab, but she was puffy like that. Her eyes were almost closed by this extreme periorbital puffiness. She had loss of eyebrows, not only the outer thirds of the eyebrows, and she had loss of scalp hair. Remember, this is a lady. Ladies don't suffer from baldness, but this lady has become bald, okay? And of course, the whole face and neck appear swollen, all right? Now, these are interesting cases because these pictures show actually the same patient when she was healthy in panel B on the right hand side and in panel A when she became sick. So who would like to tell me the differences between panel B and panel A?
Okay, starting by the hair. The hair is brittle.
Yes, here it's very brittle and dry and poorly managed.
The eyebrows also, there's loss of the outer 1/3 of the eyebrows.
Yes, although here on the right, the picture on the right, you cannot see the eyebrows because the patient is wearing eyeglasses and the frame of the eyeglasses is covering the eyebrows. So whenever you want to examine the eyebrows, the eyelids, the eyelashes, the eyes, and the patient is wearing eyeglasses, you ask the patient to kindly remove the glasses in order to see. But here she is raising her brows. The right eyebrow appears to have lost the outer third. Very good. What else?
Periorbital edema also.
Yes, very evident.
Her eyes also almost closed, yeah.
Yes, very good. But the look appears apathetic here. She looks very friendly and the eyes are almost smiling. What else?
Also, that peach cream complexion also.
Yes, peaches and cream complexion, not only on the face, but also on the chest, you see, as if she's bronze in color. She became bronze in color. What else?
The lips are swollen.
Yes.
And nose almost the same. I can see
almost the same, but the lips are swollen.
Yeah.
And so is the neck.
Lips are swollen.
So is the neck.
Yeah, and the neck also. Yeah.
How can you tell? Here the folds of aging are evident, but here where are the folds? And here the same. The nasolabial folds are accentuated because of aging, but here they are effaced under the effect of facial swelling. Excellent. Very good. Thank you. Who would like to comment on this lady? Again, the same lady. We have the patient on the right side when she was normal and on the left side after she became sick. Who would like to comment?
I can comment, doctor, if you like.
somebody else, but the rest of you are
والله
sleeping
بديهم
or what?
فرصة.
The others are
عارفة.
sleeping. يعني if I look at the participants, I will lose the share. So please, يعني try to help me because we have only 10 minutes left. يلا.
I can comment.
I can
Yes,
comment.
yes, comment please. Go on.
The eyes are puffy.
Yes,
The eyebrows are not
they are normal.
didn't change.
The same. They are
Yeah.
normal. There is no loss of outer thirds of the eyebrows. Yes, what else?
The hair is more or less the same. I guess
No,
it's a
no,
bit dry
here
or
it's
brittle.
yes, here it's a bit poorly
Brittle,
managed
a
and
bit.
brittle. Yes.
Mm.
Wait, what else?
The nose is swollen. The lower
Yes,
lip is swollen.
yes.
And the neck there's goiter.
No, there is no goiter, but the neck is swollen. You
Swollen.
see again the fold of aging is effaced. And here the face, is it swollen also or just the neck?
Yes, the cheeks are a bit swollen.
Yes, the whole face is a
Droopy.
bit swollen. Yes, okay. And she has she has mild pallor as well, right? Okay.
دكتور كان في حد بيسأل على الشات هو الفيشل features reversible on treatment
Yes.
Yeah.
ولا
In hypothyroidism, because they are soft tissue features, they are reversible. But in acromegaly, since most of them are bony features, only the soft tissue regresses, but the bony changes will not regress. All right? Is it clear? It makes sense, of course, because once a bone has enlarged, you cannot bring it back to the normal size. Okay? Anything else you want to add to
دكتور
this? Yes?
دكتور اكروميجالي السوفت تيشو بترجع تاني طبيعية؟
Oh, it regresses, but the bony changes, they don't regress.
اوكي
Okay?
شكرا.
أهلا. طيب, okay, anything else you want to add to this picture? To comment on this picture?
هي اللبس إديمة بس
Okay. Mainly the
There's
lower lip.
bitemporal hair recession also.
A bit, yes. Here, particularly
Yeah.
on the right side. Okay.
Mm.
Yes, excellent. Thank you very much. Now, this is how a myxedema coma looks like. Maybe I showed you this picture last time in the lecture of endocrine emergencies. I've seen 3 cases of myxedema coma in my life since 1991 till the present date. Unfortunately, all of them passed away. Mortality rate 100%. All of them were ladies in their 60s, their late 60s, and they looked like that. Severe pallor with facial swelling, periorbital edema, with bags of water affecting upper and lower eyelids, and loss of the eyebrows, loss of scalp hair, a swollen nose, swollen lips, macroglossia, and of course, this patient is being managed in an intensive care setting. How do we know that? She has a nasogastric tube in place, the one which is graded, and she has an endotracheal tube, the orange one, in place because myxedema coma patients, they usually have hypoventilation, and so they require oxygenation even by mechanical ventilation. All right. And loss of hair, mind you, it may start like that only in the temporal region, but when it progresses, it can affect the whole scalp, like here. Okay. So have you ever asked yourself why, in particular, does hair loss occur in the temporal region and in the lateral thirds of the eyebrows? Why, in particular, in these areas? Who can tell me?
والله يا دكتور أنا عندي تفسير بس هو أهبل شوية.
طيب قولي.
ممكن عشان هم البيشنت مثلا لو حد بينام على المخدة مثلا أو دي أكتر حتة تبقى معرضة لل
Yes, very good. Friction with the pillow.
friction.
Friction with the pillow. Whenever we lie on our side on the pillow, the area, if we lie on the right side, the right temple and the right side of the eyebrow is exposed to friction with the pillow. Okay, since the hair follicles are weak and the hair is brittle, it may fall off very, very easily. Okay, so this is why you noticed the differential temporal recession in the man that I showed you the picture of. He had more temporal recession on the left side. This means that, and he had also loss of the outer third of the left eyebrow. This means that he sleeps on his left side more than on his right side. Okay? Very good. But mind you, alopecia in autoimmune hypothyroidism may be due to alopecia areata, like in this picture, okay? Because alopecia areata is an autoimmune disease affecting the hair follicles. It can be patchy, like here, and can be localized, but it can be also generalized, what we call alopecia areata totalis or alopecia areata universalis. Remember the big actor who used to feature in many films as the bad boy, and with Adil Imam in the play شاهد ما شافش حاجة المتهم in the cage. He was very tall and very big, and he was totally hairless. He didn't have any hair on the body whatsoever, not on the scalp, not on the eyebrows, and not on the body even. Okay, this is a form of severe alopecia areata universalis. All right. And of course, vitiligo, which is another autoimmune disease of the skin, which is milky white patches, whether they can be localized like here over the back or here over the knees. This is the normal skin color, but these are the vitiliginosus patches, or it can be generalized, like affecting the whole body. Who was the celebrity, the famous celebrity who had generalized vitiligo? Who can tell me?
Michael Jackson.
Yes, exactly. He was black in color, like the rest of his brothers and sisters in Jackson 5, but then at some time point in his life, he turned completely white. Okay, so this is another autoimmune disease to look for, or that can occur with hypothyroidism due to autoimmune thyroiditis. All right. And this is the carotenemia. This is the palm of a normal person compared to your own. The palm is evenly pink in color. But here on the right side, the arrow points at the palm of a patient with high primary hypothyroidism that appears orange yellow in color. And here is the same. Why? Due to hypercarotenemia, with excessive carotene in blood depositing in various tissues in the body, not only over the face like we have seen in peaches and cream complexion in Caucasians, but also in the hands and feet. And this reminds me of a female patient that I have seen, a young female patient. She was 25 years old. She came complaining at the endocrine clinic many years ago about the orange yellow discoloration of her hands and soles. I was really very astonished. Back then, I was an assistant lecturer attending the endocrine clinic with the residents. I frankly didn't know what to tell the patient. So I told the residents, please admit the patient and we will investigate. It turns out she was anemic. She had iron deficiency anemia, hypochromic microcytic anemia, and it turns out she had a severely elevated TSH. It was over 100. So this was her complaint. This means that you need to respect the complaint of the patient. She did not complain of anything else except this discoloration, orange discoloration of her palms and soles. Okay? So you have to take the patient's complaints seriously. All right? And this is the dry, scaly skin. This is the dry, scaly skin in a Caucasian patient. You see it's wrinkled and it's rough like paper sand. And this here is exactly the same skin color and texture of Al-Hagga Zainab that I told you about. It had scales like fish scales. It was very rough like sandpaper, and it was cold and it was very dry. All right? And this is how a baby with congenital hypothyroidism would look like. He has coarse facial features with a swollen nose, swollen lips, a large tongue protruding from the mouth, periorbital puffiness, an apathetic look, a weak, hoarse, deep-voiced cry, loss of the eyebrows, brittle, dry scalp hair, and he has a pot belly, Kirsch, with a persistent umbilical hernia. And of course, the mother would notice her child doesn't pass stools after each feed. It's normal for babies to pass a stool motion after being fed, but this is